So let's discuss about the muscles of pectoral region. So in that, the first thing we need to understand that there are main three muscles in the pectoral region. Out of that, pectoralis major, pectoralis minor, and subclavius, which are the pectoral region muscle, which where the pectoralis major and minor, which is one of the important muscle where we have to deal in physiotherapy field, even not even the subclavius, but we get many patients who have pathologies in shoulder because of these two muscles, pectoralis major and pectoralis minor. The another muscle named serratus anterior, which is not purely a part of pectoral region or a chest region muscle, but still it comes under this category. So these are four main muscles which we are going to discuss today. So the first we are going to start with the pectoralis major. So as we can see in the diagram, the pectoralis major, which is a large muscle of your chest, that's why it is named as major, pectoralis major. So it is originated from the anterior surface of the medial two-third of the clavicle. So from the clavicle in the medial two-third part, this is here is the clavicle. So from here, medial two-third of the clavicle is giving origin to the pectoralis major. The clavicular fibers are originated from there. Then half the breadth of the sternum, the anterior surface of the sternum, from manubrium sterni till the sternum, up to the six costal cartilages. For in this area, half the breadth, if you see the sternum, the half of the breadth of the sternum on right side and then same way on the left side, you'll be giving origin to the sternal head of the pectoralis major. Even the second to sixth costal cartilage, sternal line up to the or sternal line of the sixth rib, that also gives origin to the costal fiber, saying that with sternocostal fiber will be originated from the sternum, half the breadth of the sternum on the anterior surface, up to the sixth costal cartilage, and from the second to sixth costal cartilage, you will be having origin of the uh, pectoralis major, mainly the sternocostal fiber, and then aponeurosis of the external oblique muscle of the abdomen. So we have an abdominal muscle, external oblique muscle. Those muscles will be having an attachment, extra attachment named as aponeurosis. From that same aponeurosis, also the pectoralis major fibers will be originated. It is inserted into the bilaminar tendon on the on lateral lip of the bicipital groove in the form of U shape. So you have this bilaminar tendon or bicipital groove. This groove on the lateral lip, it gives insertion to the pectoralis major, while on the medial lip, it gives insertion to the teres major, and within that groove, you'll be having insertion of the latissimus dorsi. So in this way, the important muscle, the pectoralis major, is originated and inserted. Nerve supply, it is supplied by medial and lateral pectoral nerve, which is a branch of your brachial plexus. And action, it helps in the adduction and medial rotation of the shoulder joint. So in the adduction of the shoulder joint or in the medial rotation of the shoulder joint, the pectoralis major is going to work. The clavicular part is helping you for the arm flexion, while the sternocostal part will be helping you for the extension of the flexed arm against the resistance and in the climbing. So when you climb on some kind of device where you have to climb up, okay, by holding your hand when you're climbing, like in pull-ups kind of activity when you're climbing, that time also this pectoralis major will be helping you. So if you see pectoralis major origin, it's very simple. एक तो ये होता है origin आपके medial half of the clavicle से, then it gets origin from the sternum, from the manubrium sternum up to the in the whole body of the sternum, लेकिन उसका anterior part or half of the breadth. So half of the breadth मतलब उसकी जो चौड़ाई होती है उसका half of the area on right side, same way on the left side. So it is having origin. Then from the second to sixth costal cartilage, that is your costal fibers. In that way, sternocostal and clavicular fibers are getting originated. Even aponeurosis of the external oblique muscle of the abdomen, वहां से भी ये origin होता है. Insertion इसका होता है in the bicipital groove, mainly on the lateral lip. Then now supplies medial and lateral pectoral nerve. ये आपके adduction के लिए जहाँ पे arm को towards the body लेके आना होता है. मीडियल रोटेशन ऑफ द शोल्डर जॉइंट यहाँ पे भी हेल्प करता है. मीडियल रोटेशन जब आप ऐसे करते हो तो वो भी आपका मीडियल रोटेशन हुआ. एंड द क्लेविकुलर पार्ट ऑफ द आर्म फ्लेक्शन, द क्लेविकुलर पार्ट इसका जो होता है, जो क्लेविकल से जो फाइबर्स ओरिजिन होते हैं वो आर्म फ्लेक्शन के लिए, एंड स्टेनोकॉस्टल फाइबर्स जो है वो हेल्प करता है आपका एक्सटेंशन ऑफ द फ्लेक्स्ड आर्म. सो व्हेन आई एम डूइंग एक्सटेंशन from my flexed arm, when I'm doing extension, this pectoralis major fiber, mainly the sternocostal fiber, will be helping me. Now clinical testing. how it is important that if you are getting a patient who is having problem with the pectoralis major, how you are going to find it out. So that is done with the checking the muscle testing, manual muscle testing. So clavicular head of pectoralis major tested by asking the patient to lift heavy table or rod. So you ask the patient to lift some heavy object. Okay, if they are able to lift, we can think that yes, that clavicular factor, clavicular head of the pectoralis major is working. आपको patient को बोलना है कुछ heavy चीज को उठाने का, उसी तरह वो heavy चीज को depress करने का, या if you are going to push it down, that is going to check your sternocostal head, sternocostal fiber. Okay, तो आप lift करो तो उससे clavicular head activate होगा, और आप उसको depress करो, उस पे press करो तो वो आपका sternocostal head activate होगा. इसीलिए pectoralis major is mainly active when you are doing push-ups activity. जब आप push-ups करते हो तो उस टाइम पे ये बहुत ही ज्यादा अच्छे से activate होता है. दूसरा, clavicular head can get prominent by resisting the arm flexion at right angle. So you keep the shoulder at 90 degree and then you again resist the further movement. So on that time, your clavicular fiber of the pectoralis major will get prominent. वो आपका वहाँ पे prominency दिखाई देगा. तो वहां से भी आप उसको पता कर सकते हो कि whether it is working or not. Then sternocostal head can be tested by extending the flexed arm against the resistance. So against you keep the flexed arm and then you resist it. You ask the patient to extend it. On that time, your sternocostal fibers will be working. So if you are able to hold it, तो वहां पे आप देख सकते हो कि हाँ भी वो मसल काम कर रहा है. इसका डिटेल वर्जन you will get when we'll keep or we'll update a video on manual muscle testing. But यहाँ पे अभी just in a brief manner, we are discussing about the clinical testing. The sternocostal head is made prominent by abducting the arm to 60 degrees and then you ask the patient to touch to the opposite hip. So you abduct the arm for 60 degrees, you resist it and then ask the patient to touch to the opposite hip. So in supine position you need to do. So that is also another way by which you can find out the sternocostal head is working or not. And even you can ask the patient to press the fist against each other, like in this way. You can see in the diagram, in the figure. So that is so these are the different way by which we can find out the whether pectoralis major is working or not. Another important thing which I want to explain over here, that rather than weakness, pectoralis major muscle is prone to develop tightness. You will get patient who is having pectoralis major weakness, but at the same time, you will get plenty of patient who is having pectoralis major tightness. And that can give rise to shoulder pathology or even the neck pain, all those issues, yeah, upper back pain. So that's why this muscle need to be strengthened, and at the same time, it need to be relaxed also. So इसीलिए we need to understand how to check out the length of the muscle, okay, the length of the pectoralis major. That again in detail we'll discuss in the some other video. But clinically, we get many patients who have tightness of pectoralis major, and that can bring rise to many kind of painful shoulder joint or painful neck or those kind of issues. The next muscle, what we are going to discuss is pectoralis minor, which is underneath the pectoralis major. Pectoralis major के नीचे होता है. So as name itself, we can say that it will be a smaller in size. So we can see over here, the one side you are getting pectoralis major, other side is pectoralis minor. So the origin of pectoralis minor is from the third, fourth, and fifth costochondral junction, third, fourth, and fifth ribs, and near the costochondral junction of third, fourth, and fifth ribs. So costochondral junction is the junction between the costal cartilage and the ribs. That's why it is called as costochondral junction. And intervening fascia covering the external intercostal muscle. So the external intercostal muscle, which is an intercostal muscle, and the fascia which is covering that, it also gives the origin to the pectoralis minor. It is inserted on the medial border and upper surface of the coracoid process. So in the scapula of the scapula, you get coracoid process. उसके coracoid process पे उसके medial border पे ये insert होगा, जबकि वहां से origin होता है आपका biceps and coracobrachialis. The nerve supply, it is supplied by medial and lateral pectoral nerve, same like pectoralis major. The action, it draws the scapula forward with serratus anterior. So like in this way, the protraction movement of the scapula is done by, when you are moving your scapula forward, it is done by, or else if you see in this way, so यहाँ पे, along with the serratus anterior, it is helping you to move your scapula forward in a protraction movement. So it is done by this pectoralis minor muscle. It also depresses the point of the shoulder, so it helps you in the depression of the shoulder, and it helps in forced inspiration. For a deep inspiration, when you are trying to do a deep inspiration, then also your pectoralis minor will be working. So pectoralis minor origin होता है थर्ड फोर्थ और फिफ्थ रिब से, उसके कॉस्टोकॉन्ड्रोल जंक्शन से, वो इंसर्ट होता है कोरिकॉइड प्रोसेस ऑफ द स्कैपुला पे, नव सप्लाई होते हैं अगेन सेम लाइक पेक्टोरलिस मेजर, और ये आपके स्कैपुला को प्रोट्रैक्शन मूवमेंट में लेके जाने के लिए, जहां पे उसको सेरेटस एंटीरियर हेल्प करेगा, ये आपके शोल्डर को डिप्रेस करने के लिए भी हेल्प करता है, और ये आपको फोर्स्ड इंस्पिरेशन मतलब गहरी सांस लेने के लिए भी ये हेल्प करेगा. So in that way, pectoralis minor. Now pectoralis minor, same like pectoralis major, this minor also tend to get shortened. और जब ये टाइट हो जाता है, on that time it will cause anterior tipping of the scapula. The scapula will move forward anteriorly in this way, and it will cause prominency of the inferior angle. If you see that patient from the behind, you will find that inferior angle is more prominent. This is mainly seen when someone is having shoulder pathology, जिसको एक स्कैपुलर डिस्काइनेटिक पैटर्न के फॉर्म में देखा जाता है. इट इज अगेन अ वास्ट टॉपिक टू डिस्कस. Again, here we are not having that scope in this video, because we are just talking about the normal anatomy of all these muscles. But yes, in future we will make another video on the scapular dyskinetic patterns. So in that one is anterior tipping pattern, जहाँ पे ये commonly it is because of tightness of pectoralis minor along with weakness of inferior fibers of the trapezius. So that is, so यहाँ पे उसका scope नहीं है discussion का. So right now we are just limiting our discussion on the pectoralis minor anatomy. So I hope this is clear. The next muscle what we are going to discuss is your subclavius muscle. Subclavius muscle, which is a very small muscle. By name itself, we can say that it is below the clavicle. Sub means below, clavius means clavicle. So it is originated from the first rib at the costochondral junction. So first rib, which is just below the clavicle, वहां से वो origin होगा उसके costochondral junction से, and insert hota hai in the subclavian groove in the middle one third of the clavicle, which is in the inferior surface of the clavicle. Clavicle के inferior part पे subclavian groove होता है जहाँ पे ये muscle insert होता है. Now supply, it is supplied by now to subclavius, which is a branch coming from the upper trunk of the brachial plexus. And action, it studies the clavicle during the movement of the shoulder. आपके shoulder movement के time पे clavicle को fix करके रखेगा, and it forms a cushion for the axillary vessels and divisions of trunk of brachial plexus. So it is providing a cushion kind of structure so that your axillary vessels, the axillary artery, axillary veins, and your brachial branches of the brachial plexus can rest there easily, and they don't get compressed. Okay, so that is a function of your subclavius muscle. तो कुशन की तरह काम करना मतलब कि वो उसको सपोर्ट करता है, उसको एक तरह से शॉक अब्जॉर्प्शन टाइप का प्रोटेक्शन देता है. नाउ द वेरी इंपॉर्टेंट muscle what we are going to talk about is serratus anterior, and also it is called as boxer's muscle. Same way pectoralis major is called as climber's muscle. Okay, so here the boxer muscle or serratus anterior muscle, why I said it's very important, because any patient who has shoulder pathology are tend to develop weakness of serratus anterior, and when they have weakness of serratus anterior, their shoulder movement will get very difficult, they will get painful, and they don't get scapular stability. So that's why it is very important to have a good scapular stability, to have proper posture. That's why you need to have a very strong serratus anterior. So serratus anterior, it is originated by 8 digitation from the upper 8 ribs in the mid-axillary plane. So from the mid-axillary plane, your first 8 ribs will be giving origin to this serratus anterior. It's originated from the fascia covering the intervening intercostal muscle. So यहाँ से they get origin. You can see in the muscular people, you can see the serratus anterior, all 8 digitation. You can see over there. The insertion, it is inserted in the costal surface of the scapula along with the medial border. So the first digitation, we have 8 digitation. Out of that, the first digitation will be inserted into the superior angle to the root of the spine of the scapula. So scapula का जो superior angle होता है वहां से लेके root of the spine तक वो on the medial border वो insert होगा. Next two digitation, मतलब second and third digitation will be inserted from that root of the spine up to the medial border का lower part तक. so lower down on the medial border, and the lower 5 digitation is inserted over the large triangular area on the inferior angle. So mainly all the, out of that 8, the 5 digitations are inserted on the onto the inferior angle. The first digitation inserted from superior angle up to the root of the spine of the scapula, and 2 digitation, that is second and third digitation, will be inserted over the medial border from root of the spine up to the inferior angle. So in that way, this insertion of the serratus anterior is going on. Now supply, it is supplied by nerve to serratus anterior, which is also called as long thoracic nerve, which has root value of C5, C6, and C7. It's a branch of brachial plexus. And now the main important thing, action of serratus anterior. So along with the pectoralis minor, it helps you to pull the scapula forward in the protraction, as I said earlier in the pectoralis minor. So it pulls the scapula forward around the chest wall to protract the upper limb. So same like in pushing movement or punching movement, pushing movement. If you're pushing something or if you're punching something, on that time the serratus anterior is going to work. So that's why it is called as boxer's muscle. So that to punch properly, if you have a very strong serratus anterior, your punch force will be very good. The fibers from the inferior angle of the scapula, it pulls it forward and rotates the scapula to turn glenoid cavity upward. So the inferior, the fibers of the serratus anterior, which is inserted on the inferior angle, the 5 digitation, it helps you to pull the inferior angle forward and rotate the scapula so that your glenoid cavity will be facing upward. Okay, so whenever you do any kind of shoulder movement, ये वाला जो scapula का movement होता है, it is done by the serratus anterior, and it helped by trapezius muscle, which pulls the acromion upward and backward. तो उसको synchronize करता है with the help of trapezius. It also studies the scapula while carrying the weight. So if I'm carrying the weight, suppose if I'm carrying a dumbbell in my hand or a heavy weight in my hand, it helps me to studies the scapula. अगर जितना scapula steady होगा, आपकी movement उतनी ही easy होगी. So the proximal stability वहाँ पे अच्छी रहेगी if you have a very strong serratus anterior. And it helps in forced inspiration. Also, this helps in your forced inspiration, same like pectoralis minor. In this way, this serratus anterior has this all function. So the clinical anatomy, if you see, the first and foremost clinical anatomy which we had discussed during scapula bone, that serratus anterior, if it is paralyzed, this can give rise to winging of scapula. So we can see over here, whenever there is a serratus anterior paralysis, it causes winging of scapula, where the prominent inferior angle and medial border of the scapula will be seen. So in this picture, we can see the patient's uh, medial border and inferior angle is prominent. Same way, it's also there on the opposite side. Inferior angle is prominent over there. So this is called as winging of scapula. Patient won't be having ability to push, to properly do the push movement or punch movement, या push कर नहीं कर पाएगा. Even if you'll ask them to raise the arm above the head level, they won't be able to do. They will be facing weakness in the serratus anterior की वजह से ये नहीं हो पाता. Any attempt to cause inferior angle of scapula getting more from. So if you ask a patient to perform those movements, either pushing or punching or raising the arm above the head level, this inferior angle of the scapula will become more prominent. So that from there we can say that yes, patient is having the weakness of serratus anterior. Clinically, how you can test. So you ask the patient to push the wall, okay, forward pressure with the hand against the wall और अगेंस्ट द रेजिस्टेंस, या तो आप उनको रेजिस्ट करो या तो वॉल पे उनको पुश करने को बोलो. So this will cause prominence of the medial border or border of the scapula. वो बाहर निकल आएगा, prominent हो जाएगा और inferior angle भी वहाँ पे prominent हो जाएगा. And that is seen when there is paralysis of the serratus anterior. अगर नहीं है तो ये नहीं होगा. Okay, अगर serratus anterior paralyzed नहीं है, weak नहीं है, तो ये बॉर्डर्स और इंफीरियर एंगल, मिडिल बॉर्डर और इंफीरियर एंगल प्रोमिनेंट नहीं होंगे. वो आपके स्कैपुला को फिक्स करके रखता है, लेकिन वीकनेस के केस में वो प्रोमिनेंट हो जाता है. सो आई होप दिस ऑल थिंग्स हैज मेड इट क्लियर. So we had discussed about pectoralis major, which is the front part of the chest muscle, pectoralis minor, which is beneath the pectoralis major, subclavius, which is below the clavicle, and the last and foremost muscle we had discussed is serratus anterior. So I hope you had gone through the whole video properly. If you are getting doubt, do let me know. Okay, you can do the message. Okay. So thank you.